Hello, I'm Dr. Hassaan Tohid, and today I am here with another sensational topic as usual. And today's topic is clinical audit. Hello, welcome back. Today we are going to talk about clinical audit. So what is clinical audit? How it is done, why it is done. We are going to talk about everything in detail today. And I'll be very, very fast because I understand that you want me to complete more and more information or more things in less and less time. So let's do it. So what is clinical audit? Remember, it's a quality improvement process and done in the hospitals in the UK and other European countries. Not as common here, but very, very common, and it's a requirement for junior doctors and medical students in the UK. So how do you do that? If you are a junior doctor or a medical student and you have been given a responsibility to do clinical audit, now how do you do it? Let's begin. The first thing first is the definition. So what is clinical audit? Remember, clinical audit is to match what your hospital is doing versus the standard. What your hospital is doing versus the standard guidelines. What you are doing in the hospital versus what you are supposed to do. So let's talk about this. So let's say, for example, in your hospital, you are giving isoniazid dose that is actually, let's say, a few milligrams, and you were supposed to give lesser than that. According to the standards by Royal College, you were supposed to give lesser dose, but you were giving more dose. So now that means you have something to improve, and you can now implement this change according to the standards, and you can improve the performance of the hospital. So this is what quality improvement process through clinical audit is all about. So now how do you do it? The first thing first is, let's say you are a junior doctor, you are in a hospital. Now imagine you are standing in a hospital. Now you have been given this responsibility by your supervisor. Let's do an audit. So what do? The first thing first is decide a topic. Decide a topic. So talk to your supervisor, talk to the lead auditor, talk to the audit department, and talk to as many people as you can and come up with a topic. Once you come up with a topic, now come up with like 4 or 5 topics. I would say 5 topics. Now discuss with the audit team, the audit department, and ask them which one is the most feasible one. So choose that topic. Usually the topic that is chosen is the one that is the biggest problem the hospital is facing, or the most common problem the hospital is facing. So you can use any of those. You can choose any of those as a topic. Now let's say you have chosen 5 topics. You talk to the audit department. You go to the audit department. You will have an audit department in the hospital. You go there. You ask them. They say, okay, topic number 3 is the best one. Go for it. And now you go for it. Now you create a pro forma, and you have your lead auditor or your supervisor, whoever it is, whatever the hospital procedure is, you have them sign it, and now you begin. Now you decide a topic. You have already decided a topic. Now, what is your plan? What is your plan? You create a plan. You have a plan. Now, according to the plan, what is your team? You need a team, right? So you should have a team. Now you have a team. Once you have a team, your team would be your fellow doctors, your juniors, your seniors, your clinic lead auditor, the supervisor, or it could be anyone in the hospital. Every person in the hospital could be your team, including the patients. Don't ignore the patients. They can be your very valuable team. So once you have everyone involved, now you have a team, you have an idea, you have a topic, now you have a plan. The plan is now whether you will go retrospective or you go prospective. What does that mean? It means is whether you will look at last six months, what you have been doing, or last 1 year, what you have been doing in this hospital, and you match it with the standards, or you will follow up for the next 6 months to a year, and you will see first what is happening, and then you match it with the standards. The choice is yours. So the choice is yours. Remember, retrospective is faster because you already have the data. Prospective will be slower because you will have to collect data. So that's the difference. In prospective, you have to collect the data by monitoring the patients, but in retrospective, you already have the patients, you already have the data ready. Now the choice is yours. Let's say you chose retrospective and you selected 50 patients data who were on isoniazid, for example, and now you monitor and you check the records, you check the electronic medical records, you check the folders and files, and now you come up with a, a conclusion that, okay, these 50 patients were given this medication, and out of them, how many were overdosed or how many were underdosed, in comparison to what? In comparison to the standard guidelines. Now, what are the standard guidelines? It could be Royal College. It could be Royal College guidelines, or it could be the guidelines by WHO, or it could be NICE guidelines. Or let's say there are no established guidelines in the European system, then you can use American guidelines, maybe American Medical Association guidelines. So you can use those guidelines and you use that standard, and now you implement it and you monitor it, and you have the data. Now you match it and you see, okay, this change is needed, and now you once you have the results, your audit is complete. So this is how you complete the audit. Now let me repeat again and go into a little bit of detail so that you are clear about it. So there is something called as audit cycle. Audit cycle means that you detect a problem, identify a problem. Then the next step in the cycle is you identify the standards that you are going to use. So it is either Royal College guidelines, or it is any European guidelines, or it is American guidelines, whatever you are using. So you have identified the problem, you have identified the standards. Now you will match the standard with what you have already done in the hospital before, or you have been doing. Now, once you have it, now you will implement a new plan, and you implement it. You implement the new plan for next 6 months, and you will monitor it. Now, whatever results you have, you match it with the standards. So eventually you will be close to the standards, or you will achieve the standards. So once you have achieved it, now see if the results have improved, if the patients have improved or not. If the patients have improved, you are done. If the patients have not improved, that means you have to now go back and re-audit. So that's why it's a cycle. You improve it again. You see, first of all, you see what have you done so far. Probably you have made a mistake. You haven't implemented it correctly. Once you do that, then wait for 6 more months and see, is the quality improved? Have the results improved? So if the results have improved, that means your audit is successful. And that's called as closing the loop. So you close your audit. So your audit loop is closed. Your audit loop is closed means that you have achieved the results. That means your audit is complete. After implementing the changes, you have improved the quality of care. So this is what audit is all about. And that's why it's a cycle that you may have to do it again and again until the quality is finally improved. So what things you need to do is identify the problem, identify the standards you will match it with, and then with your team, with everyone that is involved, implement this change, take action. Once you do that, now compare. First of all, compare what you have already done with the standards so that you can make strategy and action. And once you have taken the action for 6 months, let's say, now see what are the results. Are you able to match it with the standards? Has the quality improved? So you can match it with the previous results before the audit, and you can match it with the standards. So you can match your 6 months results of action with the results that were before you implemented action or you took an action, and you can match it with the standard. So you will understand how much you have improved. So this is how you do it. And are you able to close the loop? That means, have you successfully improved the quality? If not, then repeat the cycle. You re-audit. So until it is achieved, and possibly you will have to change the topic. Probably you never know. It's a long-term project, so it can take time. But usually you go back and see why your quality has not improved. Maybe you haven't implemented something correctly. So until the loop is closed, your audit is not complete. Once the loop is closed, now you present it, and you can present it at a conference, or you can submit it to a journal. You can publish it to a journal or magazine, whatever you like. And yes, there are journals that will publish audit as well, so you can do that as well. So this is how you do audit, and that's the complete process of audit. Of course, it is not the complete process. It's just a short video I have created to give you a brief highlight of what audit is. And remember, one more question that usually asked is, what is the difference between audit and research? So remember, in audit you already have the standards, but in research you develop some new information. You develop new standards. Here you are just matching, you are improving the quality of your hospital to make sure you do everything in the right way. In research, you actually detect what is the right way. So here you are just making sure, in audit, you're just making sure that everything your hospital or you are doing or your team is doing is according to the right way. So this is called audit. And now how it is done, you know that. Who will do it? You will do it. Why you do it? To improve the quality. When do you do it? You can do it anytime. You can start right now. And where do you do it? In a hospital or in a clinical setting. So that's all about audit. And I hope you will enjoy this video. Watch it again, learn more. And if you have any question, comment below and I'll come back to you and reply. Thank you. Have a good day.